Hi folks, Dr. Tom Meade. Welcome to another edition of our show. This is part 3 with Dr. Steve Sinatra, the #1 integrative cardiologist in the country. We just had 2 great shows on his latest 2 books, Earthing, the next great medical discovery, and the great cholesterol myth, where we discuss the pros and cons of statins. We realize in our practice that the most important aspect of medical care is answering questions, putting it in language that you can understand. So we decided to just dedicate this whole show to questions. And we have a whole bunch of questions. And we're going to start out with the first one that asks Dr. Sinatra about chelation. What is chelation? What do you think about that?
Well, chelation therapy has many different phases. You can get IV chelation, where you can pull lead out of your body or pull mercury out. But over the years, these Dutch researchers have demonstrated that vitamin K2, which you can purchase in a health food store, it's called metaquinone 7. I like that much better than metaquinone 4. But vitamin K2, it's sort of found in hard cheeses. What these researchers found is that the calcification of the blood vessels was less, and Tom, you're going to like this, the calcification of the bones was more. So you could literally take a vitamin that puts calcium back into bone where it belongs and take it out of blood vessels where it doesn't belong. So I use vitamin K2 as my #1 chelating agent, in addition to omega-3 essential fatty acids and the awesome foursome. I like CoQ10, carnitine, magnesium, and ribose. That's why I wrote the book Metabolic Cardiology, where I talk about how those 4 nutrients interact. So my basic cardiovascular program for plaque stabilization or plaque reversal is a combination of a good multivitamin mineral, the awesome foursome, maybe a gram of omega-3 essential fatty acids like fish oil or calamine oil, and I like 150 to 300 micrograms of vitamin K2 per day. And that's my plaque stabilization / reversal program. And if you want more information on that, I wrote the book Reverse Heart Disease Now, which I really go into that, where we talk about reversing inflammation in cardiovascular vessels.
Great. This is from male patient. I'm on low dose of statin, 20 milligrams. I take CoQ10. I'm plagued with leg cramps as well as erectile dysfunction. Looking for some help with this problem. I hear this all day.
Yeah, I would ask this male, if he does have coronary disease, he has documented heart disease, he's had a bypass, a stent, an angioplasty, a heart attack. If he has any of those, I would say that a statin is a good thing. However, remember, taking pharmaceutical drugs is about quality of life. And if his quality of life is unacceptable the way it is, what he needs to do, what you need to do out there, is work with your doctor, maybe go on less of a statin. If you do have coronary disease, if you don't have coronary disease, and you have these quality of life issues, if you were one of my patients, I would take you off a statin. However, you must talk to your doctor. I mean, I'm not your doctor today, but when you have these issues, you really need to modify your own program, because you don't want to be miserable by taking a pharmaceutical drug, especially if you don't really need it.
And again, I want to reiterate what you just said. We are here to provide some information. We are not here providing medical advice or telling you what to do. Anything that you hear or you read today, go to your family doctor, go to your cardiologist. We're not trying to change what you do. We're here to open your minds, to allow you to educate yourself. Question. What do you recommend for a 76-year-old female with a family history of dementia, early dementia, high cholesterol, guidance for the family to guide her to become more open-minded and not overwhelmed by adding supplements and dietary changes?
Oh, first thing, if you have a family history of dementia, I would really restrict alcohol or go over it, or just go off it. That's #1. #2, I would not use any carbohydrates in the diet, especially potatoes, wheat, bread. I would recommend my colleague Dr. Perlmutter's book, Grain Brain. It's a great book. And basically, I like the fact that you have high cholesterol. If you have high cholesterol, that's going to protect you. I would rather see you doing more coconut oil, because coconut oil gets into the brain. It helps nourish the brain. We call that ketones. Avoid what we call omega-6 fats. I like olive oil, coconut oil, lots of fats, no sugars, no pasta, no breads, no white rice, certainly no bagels, crackers, any of that stuff. You must go off white flour, and you're going to have a much better chance of having a healthy memory.
Dr. Meade and Sinatra, can you comment on the use of fish oils in regard to its use in cardiac disease prevention?
Oh, I love fish oils. I mean, there's great data on fish oils. I mean, thousands and thousands of studies. And basically, you only need 1 to 2 grams of either calamine oil or fish oil. I particularly like calamine oil. That's what I use at drsinatra.com. And the reason being is for a heart specialist like myself, I like the DHA component of the calamine or the fish oil, because DHA, we call that docosahexaenoic acid. It's good for the eye. It gets in the retina of the eye. It helps nurture, support the eye. It supports the brain and supports the heart. Now, for Dr. Meade and his specialty, you would probably like some EPA, because EPA, eicosapentaenoic acid, has more anti-inflammatory activity. So when you're treating arthritis, I'm sure you would like a fish oil that's balanced with equal EPA and DHA.
I agree. I have peripheral neuropathy. I take statins. Can I just quit?
Well, you got to talk to your doctor, because remember, if you have unstable angina, or if you have, a lot of symptoms or severe heart disease, going off a statin, you could have some undesirable consequences. However, I do not like peripheral neuropathy. It's painful, it hurts, and again, it's a quality of life issue. But again, this is a question for your doctor. If you have documented heart disease and you're a male, I like statins. But if you're a female with polyneuropathy, I don't see the logic if you're a female taking statins. By the way, the worst patients that I saw taking statins were young women in their 30s, and it's a travesty. And this was a primary prevention, and I mean, I just can't believe it. So anyway, polyneuropathy, no heart disease, it's your choice, but if you were my patient, I wouldn't use a statin.
So question on earthing and grounding, and I think we addressed this in one of the other shows, but for anybody that thinks that grounding may not change the viscosity of your blood, listen to this answer. Due to blood clots in my lungs and my legs, I am taking warfarin. How will the energy in the earth, or earthing, affect my pro-time? And we'll answer that very important question after the break. Hi folks, we're back with Dr. Steve Sinatra answering questions. The latest one on earthing, how it affects your pro-time, or the viscosity or the bleeding tendency in your blood. So for those skeptics out there that say, this can't thin my blood, read his book. There's great science behind it. But if there wasn't a danger and you're on a very potent blood thinner called warfarin, if you ground, will that increase your bleeding tendency?
Absolutely. That's a contraindication for grounding. I mean, if you must ground, because of a quality of life issue, when you're on Coumadin, you must work with your physician. But I do not like to do grounding and warfarin at the same time. Now, this was clots in the legs, pulmonary embolism. So if this person goes off Coumadin in the future, and if it's not a long-term, like 1-2 years, goes off Coumadin, and you're not, I would certainly ground to help prevent clotting. So grounding there would bring a lot to the table.
This is a double-barrel question. If I stop statins, will the side effects go away right away? And if I want to stop it, do I just stop cold turkey, or do I have to taper?
I like tapering. When you ever stop a pharmaceutical drug, I like tapering because the body gets sort of used to it. And again, whenever you taper a drug or stop a drug, you must clear it with your doctor. And when it comes to side effects with statins, what I've seen is sometimes it takes time. It may take as much as 3 to 6 months to reverse some of those undesirable symptoms. But again, before considering, talk to your doctor.
So an interesting caveat that a lot of the cholesterol, most of the cholesterol in your body is made in your liver.
Correct.
It doesn't come from eating cholesterol. So, the old American Heart Association recommendation of eat less cholesterol where eggs were bad. They've actually done studies where a patient has eaten 1 egg, 2 egg, 3 egg, 4 egg, 5 egg, 6 eggs in a day and in a week, and checked that a week later. And you know what happened to their cholesterol? It went down, because the body adjusts. You know what happens when men take steroids for bodybuilders? You know what? Well, their testicles get smaller because you don't need it. You don't need it. Same thing with the liver, so it starts doing that. So the question is, relative to that, how about the other drugs that stop the absorption of cholesterol in your gut? Something like Zetia. What's your thought on that?
Again, I'm not a big fan of pharmaceutical drugs of lowering cholesterol. I mean, I don't see the value in it. Somebody's got to convince me. So I don't like to lower cholesterol. Now, you know, I do like citrus bergamot. You know, it's a flavonoid. It comes from Calabria, Sicily, in Italy. It reduces triglycerides. It reduces blood sugar. It raises HDL. I like that because for me, the more important things when it comes to cardiology is metabolic syndrome. So I get worried when your triglycerides go up and your HDL goes down. We call that the triglyceride to HDL ratio. If it's less than 2, I like it. But remember, if you're a woman and your waist size gets to be about 34, 35 inches, and you got a little high blood pressure and your HDL is going down, or you're a male and you got a waist of 40 inches and your blood pressure starts to go up and your HDL is going down or your triglycerides are going up, that's metabolic syndrome. That's an inflammatory disorder. So I like to reduce those measures. And again, a lot of it has to do with carbohydrate diet, but there are supplements you can take, and citrus bergamot is one of my favorite ones.
Yeah, and I think because your liver makes cholesterol, really it's the sugars that you eat that convert it to cholesterol, not the cholesterol that you eat that puts up your cholesterol. So a lot of that is confusing to people, but the more sugar you eat, the higher your cholesterol will go, and your triglycerides.
Right, and a classic example is, if you're at a bar and you want a glass of wine, please chase the wine down with some nuts, because that wine is pure sugar. But if you have a handful of nuts, and by the way, in the Pre-Demet study, which is a really hot study on the Mediterranean diet, the population eating 4 tablespoons of olive oil or 2 handfuls of nuts a day over a 5-year period had less stroke, less heart attack, less diabetes, less depression, and they were a lot healthier than people eating the American Heart Association diet. So I love nuts. I mean, there's great studies with the 7-Day Adventists. I love olive oil. I mean, to me, olive oil is the secret sauce of the Mediterranean diet. And just remember, it's sugar that causes heart disease. It's not fats and cholesterol.
What's your thought on coconut oil?
I love it. I love it. Again, it's great for the brain. By the way, coconut oil, because it's a saturated fat, builds more ATP into the heart, and it's a high energy fat. So if you use my awesome foursome and you want to build some more energy or more chi into your body, I love coconut oil.
If you stop taking statins, Dr. Sinatra, will your heart regain its strength if you have congestive heart disease?
Oh, great question. I believe so. I believe so because, remember, statins knock out CoQ10. So if you do stop your statin, the endogenous production, your cells make CoQ10, will gradually go up in your body. I would also supplement with CoQ10 or eat foods that contain CoQ10, like organic free-range meats or wild migratory salmon. Those are the best for CoQ10. Sardines are phenomenal for CoQ10, as well as calcium, great fish. So, change the diet. And remember this, if you're a vegetarian, you do not get enough CoQ10, carnitine, or alpha-lipoic acid from the vegetarian kingdom. You need animal product for that. So if you are a vegetarian, you must supplement CoQ10 and carnitine.
Can your feet be grounded through a carpet over a concrete floor in an office building?
No. No. This carpet, none of us are grounded in here.
So here's the free lunch. If you look at the modern electrical outlet, you have 3 prongs. You know what the third prong is? The grounding prong. So in most buildings or houses, if you follow that down, it goes to a water pipe that goes into the ground. So that's how you're grounded. And a lot of these devices have one prong. There's a little light device that tells you if the electrician did a good job or if he just charged you for grounding your house, and it goes nowhere. Because if you stick the little plug in there, the lights will go on that tell you your house or that plug is appropriately grounded. If it is, you can stick one prong in that grounding outlet, and that can go to a mat that you could sit at your desk, put your feet on the mat, and it's the equivalent of being outside in the front yard. And again, these devices are online. You can look them up. They're pretty inexpensive. For the health benefit, it's a free lunch. Is that right, Steve?
Oh, yeah, absolutely.
I like that. All right.
Yeah, when I had my hip replacement, when I got out of the hospital, First thing I did, and I was at the hospital, and I spent 2 nights in the hospital, Tom. It wasn't with you. Sorry, I didn't know.
I do knees. I just do knees.
Anyway,
knees. I could probably do your hip.
I grounded, and I slept with an electrode grounded on a rod outside, and my hip in one day went from this big, just like the other hip. I mean, it was amazing. Amazing.
So the question is I'm on Coumadin. Can I work with my doctor? I'll answer this question. Can I work with my doctor to get off Coumadin by earthing? And not unless he's an educated doctor, but go ahead, Steve.
No. Unless you're dealing with self-limiting DVT or like that pulmonary embolus situation. But if you have atrial fibrillation and you require Coumadin, no, you can't use Coumadin, grounding as a substitute for Coumadin. But if you have quality of life issues, again, you can work with your doctor. But again, I don't like the combination of Coumadin and grounding.
All right. So a lot of statins, a lot of medicines in our world came from the natural world. Statins were really stolen from the Chinese, which is red yeast rice. So the question is, I was taking red yeast rice. Can I take that? What are my risks? If I get off it, will that cause the same symptoms? How do I know? Let's answer that question after the break. Folks, we're here with Dr. Steve Sinatra answering your questions. The latest one on the natural statin, red yeast rice. Steve, your opinion?
Red yeast rice is a statin in disguise. Some of my colleagues love it. I don't particularly like it because I've had many patients who are on it and their CoQ10 levels went down. It's just like a statin, probably a little bit weaker. Citrus bergamot also has that activity, but I like bergamot better because it has much weaker, what we call HMG co-reductase inhibiting qualities. So again, red yeast rice, more natural, but again, it will drop your CoQ10 levels just like a statin will. And I've seen patients with side effects on red rice yeast as well.
Fish oil and flaxseed.
Flaxseed is great. Just remember, it will oxidize quickly. That's why the oil is in a black bottle. If you crush up flaxseed, use it quickly. I like chia seed. I did a nice video on my website, heartmdinstitute.com, where I talk about chia seed and flaxseed. So chia seed is good. And whenever you bring a little flaxseed to the table, not only are you going to get some activated omega-6 in your body, but which is a good thing, you get small amounts, but you get a lot of cleansing of the gut as well. And I love detoxification. That's why I like sweating, and that's why I like high-fiber diets, and I like chia seed, flaxseed. And if you really like something, I love psyllium husk. Organic psyllium husk will really detoxify the body in a great way.
Here's an interesting one. I've heard about sun gazers who stare at the sun for nourishment. How does this correlate with earthing?
Oh, it's a good question, but remember, when you sun gaze, you do not want to do it for prolonged periods at less than 60 seconds. You want to do a quick sun gaze meditation by squinting the eyes and looking into the sun? I like it, but you don't want to spend 3, 4, 5, 6, 7 minutes squinting your eyes, because then you can get too much UV light into the eye. But if you can sun gaze for 1 minute and meditate, positive intention, just focus, ask God for help in your life, ground, meditate, 1 minute into the sun, I love it.
Earthing footwear, is there footwear out there that people should buy?
There's lots of companies that do it. Getgrounded.com is one. I can't think of some of the others, but footwear is good. Footwear is good.
So you're a cooking connoisseur, Steve. There's a question about Teflon or aluminum.
Okay, aluminum, no. Teflon, I'm not a big fan of Teflon as well. I think those plastics can leach into the food. I don't like it when they get scratched. I get really concerned because bacteria can live in those scratches. So, I like stainless steel. I like glass or copper to an extent, but those other easier pans, I'm not bullish on at all.
I'm so glad to hear the myths of cholesterol and statin use becoming more mainstream. I'm a huge advocate of natural, organic, whole foods without dyes. I'm not comfortable with the use of supplements because I do not see the data to support their use in terms of statistically significant efficacy to decrease mortality, also in the long-term unknown side effects. What makes you feel they're valuable and not too risky?
Well, first of all, I've been using supplements for decades. I mean, I started formulating my own supplements since 1990 because some of the supplements out there can harm you. I mean, if you're a male, you don't want to take too much iron or any iron at all, or a postmenopausal woman shouldn't take iron. You shouldn't take even large doses of copper because they're pro-oxidants. And in some of those studies, certainly they're valid, where these women taking iron, they had more illness. But these were postmenopausal women, and you shouldn't take iron. The same thing is true with too much manganese or too much beta-carotene, even too much vitamin E. Over 400 units of alpha-tocopherol succinate can have a downside. So when you take vitamins and minerals, you got to find somebody you trust. You got to find somebody who knows what they're doing, because vitamins and minerals in large doses, you can get a pro-oxidant effect or a pharmaceutical effect. Do I believe in supplements? You betcha. I mean, I take supplements myself. I think supplements do a world of good, because you cannot get the amount of supplements you need from our diet. And I'll use magnesium as an example. Most of the people in this room are magnesium deficient right now because it's not in the water supply. It's not in the soils like it used to be. So magnesium is one that we absolutely need. That's why I include it in my Awesome Foursome. And I can go forever on this, but there is huge data to show that targeted nutritional supplements do make a difference in your life.
Here's a question. Can you comment on the use of skin reactions with supplements?
Very rare, but can happen. Hives is one. I've seen it. I've seen little macular rashes. But again, let's take something that people put in their skin all the time, sunblocks and sunsprays. I mean, you get reactions from those. In fact, I am not a big fan of those, because I just believe that the only true, really good sunblock is what the lifeguards used to use years ago, and they used to use the zinc oxide in their nose or their lips. That's a true sunblock. But today, the sunblocks are nanoparticle size. We absorb that stuff through the skin, so they have a downside. So when it comes to the skin, anything you put on your skin can have a reaction. And again, slight reactions, especially niacin. I do not like niacin for a lot of people because of the flush. Some people love it, but I got most of my calls from niacin because of the tingliness, the itchiness, and that can be a factor with niacin, so beware of that one.
So with homocysteine breakdown causing inflammation of the vessels, one of the treatments is niacin. What's your opinion if you have a reaction? Is it bad for you? Or how about the non-flushing niacins?
You know, non-flushing niacin doesn't work as well. But remember, with high homocysteine, what you really need is vitamin B6. You need a high-quality folic acid. I really like MTHFR, which is methyl tetrahydrofolate. I'm putting it in my vitamins now. It's much more expensive, but it gets into the brain. And remember, methylcobalamin, a B12. So if your multivitamin has methylcobalamin, B12, vitamin B6, and some folic acid, your chances are your homocysteine will go down. I love beets and broccoli. Nice organic beets and broccoli, that also will drive your homocysteine levels down as well.
Steve, you're better than Wikipedia. This is unbelievable. I mean, we could sit here all day and answer questions, but we hit most of them, and I think our half hour is up. That was an absolutely unbelievable series. I can't thank you enough for being here. Yeah. Our audience appreciates it. Folks, I hope you liked it. Hope you enjoyed the show. We'll see you next time. Steve, thanks again for coming.
Thanks.